Hi, my name is Sean Dunn. I'm 37 years old. I 5 weeks ago went through double jaw surgery, and my double jaw surgery was a little different than a lot that I've watched on YouTube, and I kind of wanted to go over it because I feel like A, I'm older, and B, I had a unique procedure done on my double jaw. So anyway, on my procedure, basically what they did on mine that was different than a lot is I have an underbite, and I had an underbite, and on my underbite, my teeth were up inside where you couldn't see them. I would smile, and you would see no top teeth at all. So what they did on me was they lowered my teeth 5 millimeters down on my top. So now when I smile, you can see teeth, which you couldn't before. And I'll post videos of the before video and weekly progress videos. But what I wanted to post basically is kind of some backstory. A lot of people, we've all had braces. Not everybody is blessed with a perfect genetic mouth, and I definitely wasn't one of them. And throughout my life, I've had braces. And when it came to this surgery, I was on the fence. I was like, oh, I don't know whether I can get approved for it. And I pretty much shot it down. And finally, my orthodontist was like, hey, Sean, we've done all that we can do. And it's not going to be that great. Let's see if you get approved for surgery. And like I said, I was on the fence about it. I didn't think I could get it. And all of a sudden, I said, fine. And I went to the oral surgeon, Adam McCormick in Layton, Utah. He took good care of me. He basically, sent my case to the insurance. They approved it. And within about 4 months, because of COVID and everything being delayed because of COVID, I finally had surgery July 8th. And today is August 9th, so it's been close to 5 weeks. I can tell you that this surgery was very difficult. I remember, when I woke up from surgery, I had a hard time dealing with the pain, and I kept holding my breath. And the whole time that I was holding my breath, they wouldn't let me leave the ICU because they were saying, hey, you have to breathe. I remember that clearly. And I remember, I didn't even remember going in. Like, I remember them wheeling me away and putting, like, the anesthesia in, and I blacked out, and I woke up, and I thought I was still going in, and I hadn't gone. Like, I thought I was still going in, and I was done. So, it was a crazy thing there. And then, the night stay in the hospital, because I ended up this took 7 hours for this surgery to get done. And basically, I remember, my biggest thing was I had a hip graft, so they gave me a hip pain management system. So I had like this bag next to me with a catheter in it, and it was like pumping pain medication. They had a respiratory like mask on me so that I could breathe because they were scared I couldn't breathe. And it was like humid air was going up my nose because right after jaw surgery you cannot breathe. Like your nose is plugged. Even mine right now is still kind of plugged. And basically, I was in the hospital for that like morning. They tried to give me a shake. There was like no way in heck I could eat a shake. Like, I had to basically take my water with a syringe, pull the water out, dump it into the milkshake, and then basically suck out the milkshake that's water diluted and put it in my mouth and shoot it in. So it was a very hard process. Also, like, they gave me a walk. I don't think I was quite ready for the walk. And basically, I sat there and I went walking down the hallway. I started coming back, and all of a sudden I looked down and I had blood coming all the way down me, all the way down my gown. I looked at my hands. It looked like a murder scene. Like, I had never seen anything like that. And basically, I went back to the room, and I wasn't panicked about it. I just sat there like, oh wow, this is what I'm in for. Great. So, anyway, what ended up happening was they cleaned me up. My doctor ended up releasing me at noon the next day. Well, not the next day, but that day that I woke, like that morning, that afternoon, I got released. And then I had to go see him, which was a crazy thing because it was like 15 miles away, and I had to be driven by my mother there. And I know I felt like crap. I had my hip like pain bag with me. I was like barely able to walk. I had tons of pressure here. I was swollen. I could not breathe. I was like, why am I doing this? I hate this. But you know, I went in. He said, "Get the heck out of here. You need to heal." And he was right. The first week was survival. And I will say, like, if you don't have someone to take care of you, you're gonna be in trouble. Like my mom took very good care of me. Like she was disciplined. She gave me my antibiotic at like 4 in the morning. Like she would clean my mouth with salt water. She would, give me my pain medication by syringe. She would feed me everything you can imagine. Like other than basically, helping me go to the bathroom, but like she took care of me. Like, and you will have to have someone take care of you. You cannot do it alone. Um, I mean, I can't imagine doing it alone. I just can't because I couldn't move. I couldn't get out of bed. I couldn't even roll on my side. The second my hip touched the side of the bed, I would jump back. Like it was painful. So, like, and I will post videos of, I've done a video every basically week after this, and I know I'm not fully recovered. It's less than 5 weeks. I'm still swollen. I kind of have a hard time talking still. And, I'm supposed to be on a liquid diet for 10 weeks. And I'm not going to lie with you, I have cheated that because you just get so hungry. Like, it's so hard to get full on liquids. Like, I've had soups, I've had protein shakes, I've had mashed potatoes or watered down oatmeal that's watered down, milkshakes, just tons of different things, smoothies, you name it. Like I went crazy on it, and it's. I will say like it takes a lot of patience. I'm even finding myself getting impatient about the swelling and about how I still have issues drinking from the side of a glass without having it dumped down my shirt. And, it just, I guess it just takes time. And, I will tell you that for me, this has been really hard because I'm not a very patient person. There's a lot of patient people out there, and I'm not one of them. I'm used to results immediately. So, I will keep posting videos about this. Like I will say at where I'm at, almost 5 weeks, my hip doesn't bother me as much. I still wake up with a little bit of pain. Like if I roll over on it, sometimes I can feel it. Uh, it's nothing like it was at first. And, just main thing is just be patient. Like everybody says, they're right. And I have a hard time with it. So I feel your pain if you're not very patient. But, definitely this surgery has been hard, and I just want everybody to know, kind of in an older sense of kind of where you can expect to be, and that you're not alone. Like I've had this. This is, I'm still really swollen right here, like really swollen on my top lip. I can feel my stitches up above my teeth. Like my nose, like I said, is still swollen. Right here is swollen. And it's just definitely taken a lot of time. So anyway, thanks for watching. I will keep posting videos. I just wanted to kind of give this an intro. I know it's later, but I'm actually feeling like I can give the intro. So anyway, thanks for watching and have an awesome day.